Health Foundation recently issued its America's Health Rankings 2021 annual report.
Yes, and this report paints a complex picture of America's health during the COVID-19 pandemic.
Joining us today is Dr. Ravi Johar, Chief Medical Officer of UnitedHealthcare, to break down the key findings and discuss what can be done to address the successes and challenges facing the health of people in Connecticut. Thank you so much for being with us.
Oh, thank you so much for having me here.
Oh, it's a
Appreciate
pleasure.
it.
All right, so first tell us a little bit about the report.
Sure. America's Health Rankings, like you said, is a report put out by the United Health Foundation, which is the not-for-profit arm of UnitedHealthcare. And it's done in conjunction with the American Public Health Association. And what it does is it looks at 30 different reports from around the country and looks at 81 different separate health measures to get a good handle on the health of America's community. And when we're talking about health, it's not just physical health. It's physical health, emotional health, behavioral health, social health, everything that goes into making a healthy adult. And then they publish that information. Sorry, go ahead.
Oh, no, I was just going to ask you what the strengths were of our state, but you can tell us a little bit more about the report. I'm just wondering with Connecticut, what are our good points?
Well, Connecticut's actually doing very well as far as health goes. It ranks in the top. They didn't do a actual ranking of states because with the pandemic going on, states were so concentrated on trying to make sure that they were taking care of their members there that they didn't really want to do a ranking of states. But every individual health measure itself is looked at, and you can get a pretty good idea of how Connecticut's doing. They're doing really well. There's a couple things they're very strong in. There's a very low prevalence of multiple chronic health conditions, so people who have hypertension and diabetes and obesity and things of that sort. So they're doing very well there. There's a very low percentage of adults who avoided care due to cost. They're in the top 5 in the country there. And there's actually a very low prevalence of individuals reporting adverse childhood events. You may have heard of these called ACEs. And ACEs are actually traumatic events that occur during childhood, either emotional or physical, and they can manifest themselves in health problems later in life. So Connecticut is doing fantastic there.
What about the weaknesses, Doc? Are there, I'm sure we didn't rank great in everything, or maybe we did.
Well, unfortunately, Connecticut's done very, very well, but there are some areas. There's an overarching theme that you can find in Connecticut where there's a problem. That's more around social determinants of health. So there's a high degree of food insecurity. So people that are going hungry. There's a lot of income inequality. So between the folks that are doing very well and not so well, there's a big gap there. There's also a problem with housing. There's not a lot of housing available, and the housing that is there, there's a high percentage of houses with lead. So there's a couple areas there that really need to be looked at.
Were you surprised at any of the findings, Doctor?
Well, I think nationally, it's not really as surprising, but it's very disappointing that we saw the death rate in the United States go up by 17%.
Is that due to COVID?
Well, majority is due to COVID. About 70% of that increase is due to COVID, but about 30% is due to other things that have been neglected. The health measures like getting in for cancer screenings, getting in for just your annual exam. People have been worried about getting into healthcare because of COVID, and they've put off things that are really necessary and important. So we saw at least a 30% increase due to that alone.
And nationally, what were some of the key trends you saw across the nation?
Well, certainly that the not getting in for care is a big thing. There's a couple things that came out that were a little surprising almost in a way. We saw a decrease in cancer rates, about a 7% decrease in cancer, which has been going up annually.
That's good.
So that on the face of it sounds really good, but then you realize that there's been about a 13 to 17% decrease in cancer screenings.
Oh.
So is there less cancer because we're not screening for it?
Right.
That was one thing that was surprising. We actually saw a decrease in the number of people that said that you had high alcohol use, which is surprising because everything we've read and seen shows that the amount of alcohol has actually increased.
Everything, all the sales went up. I don't know.
Well, what we're finding with that is those are the people that do a lot of binge drinking. So they go to the bars on the weekend and really do a lot of drinking. They're not doing that, so that improves the numbers, but they're just doing more daily drinking at home alone, which hurts.
Okay. And really quickly, mental health, did it specify anything about mental health?
Well, mental health has always been an issue in the country, but what we're seeing is that there's a shortage of mental health providers, but we're seeing an increased number of people that are reporting that they are getting help, and that's very beneficial.
Well, this has been very enlightening. Thank you so much for being with us, Doctor.
My pleasure. Thank you, guys.
All right. For more information, visit uhc.com or americashealthrankings.org. Really interesting.
Yeah.